So let's begin the Board of Health meeting for September 30th, 2020 at 5:02 p.m. We have Aria Zayas, myself, Lynn LeBlanc, Kristen Kennedy in attendance. Chris Mills is not in attendance. In keeping with the ongoing emergency order from Governor Charlie Baker to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the emergency declaration, this meeting will be conducted over Zoom. Attendance by board members will be remote, and remote attendance shall count towards quorum. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda. All right, so the first order of business, do we have to accept minutes from the previous meeting?
Nope, I don't believe they were on the agenda.
They're not. Okay,
Okay.
so it's really just an action discussion on the novel coronavirus update. That's what I have.
Okay, I'm going to attempt to screen share with you guys and provide you with a little bit of an update. There we go. All right.
Okay, I'm trying to get back into the video screen. I seem to have lost it myself when I did that, but I'll find it again. Oh my goodness.
All right. Do you want me to go ahead and begin while you're working
Yes,
on that, Lynn?
please.
Okay. So,
oh, it also looks like Mark is here and he's asking to be accepted.
yeah, it's fine.
Okay.
I'll have to wait till I'm not screen sharing and then I'll go back and let them in. Okay, so now. All right, so first off, where are we today? So as far as the novel coronavirus and how it affects Easton. As of today, the report I ran about a couple hours ago had us at 350 confirmed cases of COVID-19 since March 12th of 2020. 148 of the confirmed cases have occurred since May 1st of 2020. It was easy for me to go back and pick that date. It really doesn't have any significance other than that was when we hit 200 cases in town. And it's also May is the beginning of when we started, I think, stretching our wings a little bit in that people were able to get outdoors and we saw the first influx of, socially distanced fire pits and visits on decks and things like that. So it seemed like a good date to kind of pick. So we've had 148 cases since May 1st. We have had 17 confirmed cases between Sunday, September 13th, and Saturday, September 26th. And the importance of that range is that every week now, the state is putting out a report that categorizes everybody as gray, green, yellow, and red. When they're doing that, they're looking at data. The report's released by 6 p.m. on Wednesdays. The data that they're looking for is for the 2-week range prior to that Wednesday. So Sunday to Saturday, Sunday to Saturday. So if we have a bad week actually really sticks with us for 2 weeks because it's a lot of times our first week and then a lot of times it's then moves to being our second week. But it takes us a while to get out of that. And if you see we have 2 bad back-to-back weeks, that's when our status, there's no dilution for having a bad week. So I track it myself and look at what we have for cases per day, and it changes. The report I ran yesterday could look different than the report I run today based on confirmation of where people live, based on new test results coming in. And again, what number they will come up with in tonight's report is reflective of a snapshot that they will took at some point today of that report. Whether they ran us at 7 a.m., 10 a.m., 3 p.m., the report could look differently, but that's the date range they're looking at. So Sunday the 13th through Saturday the 26th. Based on those numbers, it's my opinion that likely Easton will move to yellow when they release that report tonight. And that means that we would be averaging, and they do it as a daily average, more than 4 cases per 100,000, which would, if we were under that, if we were below that, we would still be green. Now for Easton, because we have just about, I mean, a little bit less than 25,000 people, that means 1 case per day is all we can have. So we need zeros in there in order for us to stay green. We have zeros. Unfortunately, we also had a day that had 5 positives. So the numbers do change, and they are kind of reflective of activity. For the week, the 13th through the 19th, we did have 10 cases. The 20th to the 26th, we had 7 cases. And as I said, one of those, we had 0, 1, 5. So it doesn't take much to really throw us over. I thought it was interesting, and I kind of keep tabs myself on the age range. And what's not reflected in here, somehow I lost a column when I did this. We did have 1 under 18-year-old, but as you can see from this chart, the majority of those 17 cases fall in the 18 to 39-year-old range, and are likely, not absolutely, but likely the result of social interactions and people lowering their guard, which is just something that we all really need to be conscious of, especially as we move into the colder weather, and that want and desire to connect is going to kind of force us to make decisions between not having contact, having responsible contact, and being indoors, which we all know really does kind of help spread, because we don't have the air exchange that we've had around those socially distanced fire pits. So it's just something for people to be aware of as we keep moving through the fall and through the stage of the pandemic.
Can I
So
just mention or ask something, Kristen?
sure.
Those 18 to whatever 29-year-olds, those are students, or those are people who live in this town, but they could have acquired it away at college. Is that my understanding? And
No,
no. So
no.
this is
Colleges, college cases remain with the jurisdiction in which they were diagnosed.
okay. Good to know.
So if we had a student that went to XYZ University in the town of East Quack, and they came home to isolate, they would not be counted as our case. They
Okay.
would be counted in the municipality where they were residing while they were being tested. So they're trying I mean, that's why the charts vary a little bit here and there. And as I said, it's a snapshot. But, and again, that could throw us the opposite way, because we do have a university. We have a college in town. They have not been impactful to our numbers. Kudos to all the steps that they're taking and to the responsible behavior we've witnessed thus far. Keep it up. But it would impact us adversely if it were our college. It does not impact us adversely if they were away and just came home to quarantine or isolate.
Kristen, can I ask you a question too?
Sure.
For the map and the changing the color of the town. So the average of being, 1 case. So that is the average of cases per day, not cases in that 2-week window, correct?
So the way it's been explained to me is that it's every day's average is calculated, and then they're averaged together. And there's some, I can't get it, it depending on who you talk to, it's how many decimal places out you extrapolate it. Again, it's when they take that snapshot, because, if they withdraw a case depending on when they withdraw it, when they take that snapshot, and whether it was a standalone day versus a high day, and how impactful it can be. Again, I tend to look at this as a guide. It's not meant to be an absolute, the sky is falling, our status has changed, but it is a guide. It's something to show us which way we're trending. And by looking at the 2 weeks worth of data, it does kind of show us a trend. So we were able to, as I mentioned, the 13th to the 19th, we had 10 cases. At one point, I thought we had 11 that week, but one of them got moved back to another jurisdiction. What was kept keeping us in green that particular 2-week snapshot was that between the 6th and the 12th, we only had 2 cases for the entire week. So we had 2 and 10, we had 12 across 14 days, as opposed to right now, we have 17 over the 14 days that we were looking at. So in all likelihood, we will move to yellow. The hope is that we will move back to green. We still have to live with the 7 that we had this week as we go into 7 that we had last week as we go into this week's data. Today being Wednesday, knock on wood, we don't have any new cases Sunday, Monday, Tuesday, and up until the time I started this report this week. So, again, it's just a guide, and it is just something for people to consider, especially as we start going into, we've got a long weekend coming up. We've got some holidays, which I'll cover in a latter slide, as far as, just reminding everybody to be conscious of the interactions that they're having and the precautions that they're taking. So what are some of the ongoing prevention level things that are going on at the town? So town hall remains closed to the general public. The town is also now offering limited in-person service via appointments for residents who can't have their specific needs met. There is information on the town website on how to request one of these in-person appointments. There's also, if somebody out there doesn't have internet access or is having trouble navigating the town website, the dedicated COVID-19 hotline, service line, whatever we want to call it, that is manned by Board of Health staff, is available for help in booking one of these appointments as well. There is a typo on the town website. I will work on getting it corrected tomorrow. And I think most people would logically, it's listed as 203 instead of 230. And most people in Easton would realize that it should be 230, but we're working on getting that fixed. The Easton Emergency Management Association executive team continues, that's assigned to this. I mean, the executive team could fluctuate depending on what it is, what the emergency is the town is working on. But our executive team that's been in place and has been meeting regularly since this began continues to meet twice a week to provide departmental updates, plan for upcoming challenges, and share information. We also right now are doing a daily check-in with the Easton Public Schools Administration, myself, and the public health nurse, just to check on information and cases that are reported and information that's coming into the schools, as well as information we may have that may need to be confirmed or shared with the school system to ensure that we don't have anybody reporting to school that is not supposed to be out in the community because of a quarantine or an isolation order. Segueing over now to flu season, because of the COVID-19 pandemic, reducing the spread of other respiratory illnesses like the flu and are extremely important as we go into the fall and the winter. CDC is recommending that everyone receive a flu vaccine in September or October. And although anytime you get vaccinated, it will help protect you. There is a new Massachusetts vaccine requirement that is an important step that will overall impact, hopefully impact the respiratory illnesses that we see during the pandemic. And what that means is that now a flu vaccine is required for all Massachusetts school students enrolled in childcare, preschool, pre-K, and post-secondary education. The only exemptions are religious and medical. Homeschoolers, I believe, are exempt. But anybody 6 months of age and older that is attending any one of these programs needs to receive a flu shot by January 1st. To aid in this, the town I am working and will be releasing information very shortly that we are scheduling and going to be able to provide opportunities for staff, families with school-aged children, and other residents to obtain flu shots at clinics that we've arranged for CVS to have with us. Right now, the school-aged children, their licensure, their approvals are only for children ages 9 and up. But it's a step in the right direction, and they're trying to expand that or lower that number so that they could do 3 and up. Which we did see as kind of the parallel to this is back when we dealt with the H1N1 in 2009. There was a progression of who was able to give shots, what age groups were able to get shots from different providers. So, CVS is optimistic. I'm optimistic too, that by the time we get to our clinics, which will be late October and early November, that hopefully they'll be able to expand the population that they're able to vaccinate at these clinics with us. As I said, the other piece that I just wanted to touch on tonight is upcoming holiday celebrations. So as we move into the fall and the winter, we're all getting excited. We're all planning for celebrations that we all enjoy. CDC has offered some considerations to help individuals and their families. There is a link on your screen right now. I believe if you go to cdc.gov and just type in holidays, it will take you right there. We are going to get this link up on the town COVID-19 webpage as well. And it talks about higher risk, lower risk types of activities that hopefully can help people frame how they approach some of the holidays. With the fingers crossed, this nice weather pattern that we're in continues, and that allows us to stay outdoors, which we all know, staying outdoors, masks on, observing safe distances does go a long way in stopping the spread.
Kristen, this is great, all good news. In collaboration with the school system, could you perhaps send out information that you're going to also have on the town website into the schools via Dr. Cabral, talk to her about it, so we can get that information out there to parents?
Absolutely. That's why this is on as a discussion item. Any direction that the board would like me to take, or any areas the board would like to have us explore as far as promoting some of this, absolutely. I wouldn't anticipate that there would be any problem getting information out on both of these. So I know they're waiting for me to give them the details for the flu vaccine clinics, which will involve pre-registration. So there won't be lining up, there won't be crowds. People will have an online portal where they can register their families and themselves, and they'll be assigned a certain time to come to the clinics. We've already talked about the messaging for that. And additionally, we can add messaging regarding the holiday celebrations in these links as well. So just as a reminder, any Halloween activities, since that's pretty much the first thing coming up, but also people should keep in mind with the long weekend coming up, that the governor, as of yesterday, announced that he's revising some of the orders and the steps that we're at. And one of the revisions that will take effect on the 5th, on Monday, is a revision to the gathering size limits. So for indoor gatherings, it remains at 25 for all communities. Outdoor gatherings at private residences and backyards will remain at 50 in all communities. Outdoor gatherings at event venues and in public settings will have a limit of 50 people in step 1 communities and a limit of 100 people in lower risk or step 2 communities. I'm going to explain in the next slide where that step 1 and step 2 community piece, there's no easy way to have this flow and not have one before the other without explaining. So effective on October 5th, in addition to the changes that I just mentioned, there are going to be a number of sectors that are eligible for further easing or size changes if they are, as what the governor now has released as step 2 of phase 3, and for what he's calling lower risk communities. And the way that they're defining a lower risk community at the state level goes back to that green, yellow, red designation that we're looking at as a snapshot. And a lower risk community would be defined as any city or town that has not been in the red in any of the last 3 weekly Department of Public Health reports. So for us, on October 5th, in all likelihood, will be yellow, green, green. We're considered a low risk community. If we were to continue to be yellow next week, then we'd be yellow, yellow, green. Still not red, still considered a lower risk community. So there are other communities that may go red for a week because they may have a outbreak or they may have a spike in cases associated with a school gathering, a college gathering, a facility gathering, where people work or where people live. But once that piece is under control, there will be the opportunity again, because we're looking at the 2-week snapshot, for them to hopefully go to a yellow, or even if they were red 2 weeks in a row, because that week stays with you for 2 weeks, they would then come out of it and not meet that criteria of 3 weeks in the red. Those 3 weeks in the red are really going to be basically 4 high weeks where the numbers are up over the limits. I don't think it's anything we need to worry about. I just wanted you to understand what the definition of the low risk is that they're talking about. So some of these do involve, that we don't really have performance venues or things like that. But fitting rooms, as we venture out beyond Easton, you'll be able to go into fitting rooms. Some libraries and other gyms will be able to increase their capacity while they still maintain all the sector specific precautions that are called for. So that is it for me. So I'm going to escape back out and stop my screen share. Just because the way this works as being a webinar is I have to keep checking to see if anybody has any questions. If there are people watching our meeting and they want to ask a question, the way to do that would be at the bottom of the screen to enter their question into the
Chat.
Q&A.
Oh,
I have now that I'm back in this screen, I have updated, I have promoted our 2 health inspectors, Mark and Tim, into.
Yeah, my video won't work. Does you cannot allow.
Let's see. Let's go here. Mark, you should have just.
he might have to click it too.
Nope,
There I am.
here we go. There's Mark. And Tim, you may have to click you if you want to.
I have a question about the the new gathering, does that include sports venues at a school level? And what about at a professional level? Can there be gatherings if it's limited for sports?
Professional sports are still phase 4. That's not happening.
Okay. Okay.
School sports, it actually, I believe they did not announce that they were going back because it says sector specific guidance. So they would have to go in and change that guidance to be the more than, but I believe that's at 50 anyway, 25 on the field and 25 in the stands.
I thought, I was wondering if the outdoor increase up to 250, if that included watching like high school football or something.
We'll have to check on that because the as it says, and other sector specific guidance. So if the general order now, as of Monday, says, yes, you can have 100 people in a low risk community, but the sports one still says 50, it's going to hold at 50.
Okay.
So we've got, I think part of why this was released, we found out about it yesterday, and we'll go through the week, is I kind of anticipate that some of those sector specific pieces will be updated later in the week to mirror and reflect the changes.
So things are lightening up a little. I was wondering, just going back to the Halloween thing and including information in through the school system, because let's face it, that's where all the kids are. But also, what about some signage or flyers that could be posted in the town in various places with just maybe some information on how we can keep it safer. I've been looking up on how to make trick-or-treating safer, and then the CDC had an awful lot too. I heard a doctor speak saying that, candy could be set aside for 3 days, or you could have, the wrapper taken off, hands cleansed, like all that kind of stuff. So, just information for parents, because I don't, no matter what, some sort of Halloween's going to happen,
Yep. I mean, the CDC website does a very good job, much like a lot of the things that we've seen as far as categorizing things as here's the lowest risk, here's the medium risk, here's some high risk activities, and breaks them down. We can work on trying to put something together, maybe actually, and adding a piece to our website, adding something that is definitely visually catching that can go through the schools, not just here's a blurb. Maybe we can even do like a 3-column type of, so it goes out more like a document.
That would be great. And because parents are so saturated with information now, they're just not going to click on another link,
We can work on that.
I looked on the CDC website from some of the information you had sent out to the board, but they don't seem to have anything like that on there yet that they've done.
No, they do have, here's low risk activities, but maybe we can even just put them in, 3 columns and kind of, make it just a little bit easier to digest than down a web page. Sorry, I'm tired.
That would be great. Hi, guys.
Does anybody else have any other questions or?
No, I know it's not on the agenda, but are we doing good with EEE? Because isn't this that time of year?
Yep. I again, COVID could have very much overshadowed or very much been overridden almost by the EEE. We have seen a actually, Mark, if you want to talk about it, from everything I'm recalling, the number of mosquitoes out there is decreased significantly. We have not had a hard frost yet. Go ahead, Mike.
No, we haven't. We haven't had a hard frost yet. They stopped the ground spraying, as we said in the last meeting, due to the fact that the mosquito population is on its natural decline at this time of year, and the actual positive rate for people actually getting West Nile virus or getting triple E infections goes down at once you hit pretty much October 1st. So the risk is lower, and we haven't had any positive pools of triple E in town yet. So I'm not going to go and say we won't have any, but statistically speaking, we're less and less likely to have them now. So, because it's later in the year and it's getting cooler, the mosquitoes are getting less aggressive. They're dying, going through the natural die-off stage that they have.
Thank you. Aria, nothing? Nothing in the Q&A? No?
Nope, no questions in the Q&A.
Well, thank you for that slideshow. It was very helpful in knowing where we're at now. So I think it's safe to say that we can adjourn the meeting, make a motion to adjourn
Okay.
the meeting. Today, September 30th, 2020 at 5:33 p.m.
Seconded.
All those in favor?
Roll
LeBlanc, aye.
call.
Roll call.
Sorry.
Zayas, yes.
Okay,
Lynn, you gonna vote?
I did
Oh,
before.
I didn't hear you say.
Oh, did you not hear me? LeBlanc, yes, sorry.
Sorry.
That still
All right.
gets me every time.
All right, well, we will see you all on the 13th, barring anything else coming up. As always, if you have any questions that come through you from the public, please feel free to get them to staff. Public can also be encouraged to send their questions through the COVID-19 at easton.ma.us website. Email that will get you to myself as well as some of the other leadership and support staff in town. It's been very helpful, I think, to a lot of people to getting information or questioning having questions answered about things that they may see that they're just not sure about. So I would encourage anybody and encourage both of you and Member Mills to direct people to that that email address, because it does get directly to staff pretty quickly.
Your comment reminded me that the travel ban information has become a bit of a hot topic with the 3-day weekend coming up. So I will refer people there. But that is something that there's been a lot of discussion about. A lot of people seem to think flying is contraindicated and that you have to quarantine after flying. So that's what I'm hearing on the street.
Yep. So it depends where you're flying to. If you're flying to another low risk state, then those are states that the governor says we can freely travel back and forth from. But we can direct people and hopefully if they have any little idiosyncrasies about their travel plans that aren't covered or easily digested, looking at the governor's plan, we'd be happy to field any of those phone calls. I mean,
Okay.
and emails, whatever. Email is, like I said, there's the dedicated line that will get to a person who will then relay the question to the appropriate party. The email address of COVID-19 at easton.ma.us gets immediately into, I believe it's about 5 desks, 5 individuals' emails, including my own. So that is a very quick way, if that's a way that people are comfortable asking their questions.
Okay, thank you. Thanks, guys.
All right, have a good night.
Have a
Thank
good
you,
night.
guys.
Bye, guys.
Bye.